Welcome to the third week of our online course on community and public health lecture. Last week, you discussed about epidemiology and the importance of epidemiology on public health. Now we are going to discuss community organizing and health promotion planning. The objectives for today's lesson are number one, to discuss the usefulness of community organizing as a tool of community health, differentiate community organizing and community development, explain the methods of community organizing and the steps necessary for a successful community organizing, and discuss health promotion as a strategy for disease prevention. Health. Health is basically a concern of everyone, regardless of age, race, sex, and socioeconomic status. Most common health concerns that many of us experience are number one, poor access to healthcare, and number two, there are social factors that must be changed para maging successful ang community health in the marginalized community. Now, I want you to read this Facebook post that I came across with. Please pause this video for a while to read the post. In relation to this post, the ultimate goal should be a healthy community without leaving anyone behind. But what is our reality? There are still many people who are left behind, especially those belonging in the minority group, those who belong below the poverty line, those who are considered to be marginalized. Kaya important na a holistic community health must be achieved. And when we say holistic approach, this means number one, empowering individuals. Number two, the community themselves must take actions for their own health, hindi yung umaasa lamang sila. Number three, lawmakers should create healthy public policies. And ultimately, our goal should be to create sustainable health systems in the society that is available for everyone, regardless of who you are and what you do in the society. However, this is a very challenging task because community problems are everywhere. The Department of Health can only do so much. Alone, it is not possible for DOH to solve various health issues existing in the community because problem solving requires significant skills and also resources. So, one good solution to this is to extend to the community level, meaning we have to involve the members of the community in implementing sustainable and lasting solutions to the problem. So, to achieve this, we have to have community engagement to the grassroots level. Now, what is community engagement? Community engagement can be used in order to address health related issues and promote well being of the community members. And to achieve this, we must first start with the very basic, and that is to organize the members of the community. This is how community organizing becomes a tool that can be used to achieve positive community health outcomes. Now, before we proceed to the core of our discussion, let us first define some terms that are often used similarly, but they actually have different meanings: community organizing and community development. Community organizing brings people together to combat shared problems and increase their say about decisions that affect their lives. In community development, people form their own organizations. The initiatives the initiative comes from the people themselves. But before this stage is achieved, the community must first be organized in order to guide the members as they try to resolve their problems. Because sometimes the community does not know what should be done and what to do and how to do it. So community organizations strive to develop a sense of community among the members. When people feel kasi that they belong in a community, there is a sense of ownership to it. And consequently, they will be more willing to resolve the issues existing in their community. Alone, most people are powerless. Kaya, community organizing creates power for people by bringing people together around shared concerns. So we can say that community organizing helps to accomplish what the community cannot do by themselves. Now, sino ang nagpe-perform nitong community organizing or sino nag-initiate nitong community organizing? Ang gumagawa nun ay ang mga community organizers. And who are these community organizers? Community organizers could be you, me, us, any institution or organization, both public and private, that aim to help communities to build themselves and to empower the community towards development. And as I have mentioned earlier, problem solving must be extended to the grassroots level. Now the question, why do we need the involvement of people at the grassroots level? But first, let us define grassroots. Grassroots are, well, basically, they are the common people, the ordinary people living in the community. Now, why do we need to involve them in the process of problem solving? Kurt Lewin said, those closest to any change must be involved in the change in order to be effective. This is anchored to the fact that the person closest to the problem sees the solution. Solving people's problems and improving their lives requires active participation of those who are most affected by the problems. So when we say that the problem solving process is grassroots, meaning in order to carry out the process, we must begin with those who are affected by the problem. And we must remember, class, that the community is not a passive actor in this picture. Their role is required in addressing various health issues existing in their own community. Example, in our current situation, control of local transmission of SARS-CoV-2 in Davao City. Everyone is affected regardless of age, sex, mayaman man or mahirap. Everyone is affected by SARS-CoV-2. Right information alone is not enough when it comes to making social improvement in our behavior. What the government did was to involve everyone in terms of wearing masks and social distancing. With that, somehow, COVID-19 cases in Davao City is controlled. Imagine if the LGU merely informed us but did not have strict implementation up to the barangay level. Do you think we will be able to control the local transmission of SARS-CoV-2 as much as the control that is happening now? Diba? Malabo. Mas lalong tataas ang cases if we were not involved in this picture. Now, there are assumptions for community organization. These assumptions lead us back to our question of why we need the involvement of people at the grassroots levels. So there are actually 9. Now, I have a very good example for this. The problem is malnutrition among kids and infants in the community. So our target here are, of course, the kids and the infants themselves. But we can also target their parents or their mothers. Na example, their mothers. Now, there are two groups of mothers. One group is given with lecture about health and nutrition. Yan, siguro mga 7 days lecture. Ganon. And then the second group of mothers naman were taught on how to prepare healthy foods. They were also taught on how to do local gardening for fruits and vegetables para may mapagkuhanan sila immediately ng nutritious food that will be prepared for their children. Now, which of these two groups of mother will bring about more impact in their behavior? Is it the first group who received lectures, or is it the second group of mothers who were taught on how to prepare food? I bet you would agree with me that it's the second group of mothers who will have a more positive impact who will exhibit a better change in terms of their behavior. Why? Because there is experiential learning. And when people learn through experience, they create a meaning out of it. And when they create a meaning out of it, it becomes a part of their system. So change in behavior becomes natural and at the same time effective. So between the two mothers, group of mothers, we can expect na mas mag-i-improve yung health status ng mga bata from those mothers who attended the second group, yung tinuruan sila on how to prepare nutritious food. Okay. Now, when it comes to community organizing, there are three typologies or methods. Now, why do we need to discuss this? Remember that each community is unique. Therefore, there is no single method for organizing community. The process is dynamic and therefore it requires flexible and dynamic skills in order to figure out what works best for a particular community. These three methods are locality development, social planning and policy change, social action. Locality development. Locality development is the base for other approaches. The goal here is to build community capacity so that the community will be able to deal with whatever issues or needs that arise. Now, this usually starts because of a specific need that arises or there is a situation that arises. Example, someone in the community notices that there is no proper waste disposal or someone notices that there is an increasing number of dengue cases. Now, locality development is a good approach when the problem that exists is a community-wide problem. No, community-wide meaning affecting everyone in the community. Locality development actually emphasizes consensus and cooperation from all sectors of the community. And each of these sectors is given with equal voice and an active participation in all phases of work towards problem resolution. This method will help to define and build a sense of community among the members or among the residents. 'Di ba? Kasi nga sabi ko sa inyo kanina, when members feel that they belong in a community, no, there is an ownership to it. And they will realize that they need to work together towards their common goal. So they will be more willing to participate in the problem solving process. Now, locality development creates participatory process. Participatory siya kasi the community members work together towards the common goal. As community organizers, yung role natin dito is more of enabler or encourager. We merely guide the community in terms of problem identification, in terms of thinking of solution to the existing problem. Guidance lang yung binibigay natin. We don't tell them that this is the problem. We don't tell them that this is the solution. Kasi the identification of the problem and the solution to that problem must come from the community members themselves. Now, the next is social planning and policy change. If locality development is process oriented, social planning is more of a task oriented. This approach is used when policymakers try to solve problems in the community. Example, sa perspective ng policymakers, they have to create a particular policy or law because maybe the community asks for it or maybe there is a situation ongoing and there's a need for a response to it or there is an existing of a long standing major issue. Now, social planning and policy change involves different levels of participation from many people. No, it involves the participation of the policymakers, of course, the community members, which are the stakeholders, and as well as the expertise of people, people's expertise from outside the community. Now, example, in today's pandemic, di ba, madami ng mga policies that have been implemented already. Before these policies are created, nagkaroon muna ng consultation ang IATF. The IATF consulted from epidemiologists, from doctors, from public health workers. So together, no, nagkaroon sila ng brainstorming and then they were able to create the certain policy. Now, that's one level of participation. Now, another level of participation is during the implementation process. The implementation is carried out by the local government units, participated by the officials, by the police, for example, or kung doon naman sa barangay level, the implementation is carried out by the barangay officials and certain authorized volunteers. Now, in a simpler sense, um, social planning and policy change must involve the participation of the policymakers, the expert members, and the expert outside the community. Tayo as community organizers, we belong to the experts from outside the community. So our role here is more in the technical guidance of community organizing. So we can assist the community in terms of fact finding, in terms of implementing activities, in terms of evaluation of the activities. So, ganon, we can help the community in terms of that. Now, as community organizers, you have to understand that community organizing is different when the initiative comes from the policymakers. Why? Because sometimes the interests of the stakeholders, the community members, are not taken into consideration. Kapag gano'n yung situation, the community leaders must have the initiative to urge the policymakers that the community must be involved in the process of crafting policies. But if the policymakers will resist the idea, sasabihin nila na ay wag na kayong makisali, wala naman kayong alam about dito. Kami ang mas may alam. So kami na ang bahala dito. Kapag gano'n yung situation, it may be now time to switch to the next mode or the next method, and that is the social action. Now, social action believes that there is strength in numbers. By banding together and taking action together, ordinary people can gain political or even economic power to create change. This approach is necessary when there is serious inequity existing in the community and there is no will on the part of those in power to correct it. Now, the group disadvantaged in the situation, yung marginalized group sa situation, through collective action, they can gain and even exercise power and bring about a more equitable distribution of official attention and resources. So they will be heard. They will be more heard when they work together. But again, class, this is only applicable kapag ka in the community merong marginalized group existing. Now, social action is somehow similar to locality development, but in a more dramatic way. Why? Because social action follows civil disobedience, and it exercises the right to protest and contest unfair or ill-conceived policies and decisions. This approach is willed on the fact that sometimes, no, sometimes mas naririnig tayo, sometimes change is possible when we confront policymakers. Example ng social action activity, yung letter writing campaign, yung mga petition na nakikita natin sa Facebook. 'Di ba? May mga organizations that ask the public to sign this and that petition, or another assembling rallies and protests, no, or making use of media to cover certain events or to highlight certain issues, so ganon. So basically, social planning engages the members to build power and at the same time advocate it so that a change will be initiated. So yung role natin dito as community organizer, it requires us to be an activist in nature. So mala aktivista kasi nga yung ina-advocate natin dito is the interest of the marginalized group. And alam naman natin that the marginalized group, they are most often the time the voiceless population. So there must be an activist in us that will aim to serve our clients' interests. Okay? But remember, class, that not one method fits all. No, it will still depend on the community that we are dealing with. So any of these methods can be employed. So the issues that the communities face are dynamic, ever changing. So it also requires community organizers who are flexible, dynamic, and flexible and dynamic in their approach. Now let's proceed to the process of community organizing. We have recognition of the problem, gaining entry into the community, organizing the people, identifying the specific problem, determining priorities and setting goals, arriving at a solution and selecting intervention strategies, and implementation of the final steps. Recognition is the first step to solving any problem. When someone recognizes that a problem is existing, it prompts the individual to do something about it. Ganyan naman talaga yung nature natin, di ba? When we see that a problem is existing, there is an urge to us to respond to that problem. At saka ganun naman talaga dapat, hindi pwedeng magsawalang bahala na lang. Now, recognition can be bottom up or top down. Bottom up recognition occurs when it is member initiated, when the recognition comes from the grassroots or starts from the grassroots level. Top down naman, or also known as outside in, if the change is initiated by someone outside the community. Now, example in our CPH, if the SPCMLS students recognize that a problem is existing in Barangay A, no, so therefore it is a top-down approach. Why? Because SPCMLS students are outsiders of Barangay A. Tapos kapag ka ganon class na top-down ang approach, the community must be notified that a problem is existing in the locality. Now, the second step is gaining entry into the community. For some, gaining entry is an easy task, but actually it's very crucial. Why? Because if the members of the community do not allow you to organize activities in their community, therefore, community organizing will fail. So, the question now is how to succeed in this phase of community organizing. The best you can do is, of course, study the community before making any approach. Dapat alam nyo kung ano yung game, no, ng community. Plan your moves well so that you can convince the gatekeepers of the community that a problem is existing. And who are the gatekeepers? The gatekeepers can be the barangay captain, the purok leader, or religious leaders, no? You will need to ask permission from them in order to gain access to the community. And once you get their approval, then you can proceed to the next step, and that is organizing the people. Organizing the people means obtaining support from the community members. How to achieve this? We must first start with those who are interested in resolving the problem. Of course, it's never possible to include everyone right away. So, always start with individuals na merong pakialam, 'di ba? Alam nga naman yung uunahin mo pag-approach yung mga taong walang pake, 'di ba? So, kung sila yung uunahin mo, sa tingin mo, you will be successful in your community organizing? Ba? It will be very difficult. So, start with those whom you can easily work with. And choose these people properly because they will serve as the core group of the community organizing. They will serve as the backbone and they will do most of the work. Now, pag meron ka nang na-create na core group, this core group will now proceed to recruit more people to join the cause. Now, you may be wondering why the need to recruit. Of course, class, the core group will not be enough to do all the work. Recruiting more people will delegate tasks and also will create more resources. The more people working, the lighter the workload becomes. And remember also that this kind of work is voluntary. Kaya, even though unpaid, dapat merong pa ring scheme to encourage cooperation and participation. Like maybe you can give, or there may be incentives or can provide perks or benefits for being a volunteer. Or you can provide trainings so the skills that they will gain will serve as their compensation for their hard work. And of course, do not forget to delegate the tasks well para hindi naman ma-overwork yung ating mga volunteers. The next steps are identifying specific problem and determining priorities and setting goals. Now, assessing the community is done in order to identify the needs or the problems of the community. Needs assessment include gathering of information and analyzing this data about the issues or the problems that have been found out. Now, the goal of needs assessment is to clearly identify the problem of the community and after which prioritizing these problems. We need to prioritize these problems because basically we cannot solve all problems at the same time. Likewise, appropriate strategies must be crafted in order to properly allocate resources during the implementation process. And please remember also, class, that during identification and prioritization of problems, there must be a sense of ownership to the problem. 'Di ba sabi ko kanina, when the community members feel that they belong in a community, they will have a sense of ownership to it. And when they feel and own their problems, they will be more motivated to work towards resolution. Ah, and then after, goal setting. The community must be aware kung ano yung goal ng community organizing. Goals are set in order to guide the community on how to resolve the problems. Goals are what the community would want to achieve as they provide solutions to their problems. Tsaka mas madali naman talagang mag-work kung alam mo kung ano yung target goal, hindi yung blinded ka. 'Di ba? Kasi kung alam mo kung ano yung goal, the activities will be aligned properly. And pagka ganon, the success rate will be higher. Now, after data analysis, it must be aimed that a solution will be achieved and an intervention will be planned. When we say intervention, these are set of activities. No, set of activities planned to address the existing community problems. Yung solution naman is the proper selection of appropriate intervention activities in order to resolve the problems and to arrive at the goals set in the previous step. And lastly, implementation of the final steps, which include implementation of the intervention activities. When we say implementation, it is simply putting plans into action. This is, of course, performed or done by the community members themselves. The community organizers merely guide the community members in this process. Now, after implementation, the results must, of course, be evaluated para malaman kung na-achieve yung objectives, kung na-achieve yung goals. Now, pwede namang gawin ang evaluation even during the process of implementation kahit wala pang result or konting results pa lang yung nakikita natin. Now, kapag ganito yung approach ninyo, class, if evaluation is conducted during the implementation, this will help optimize the implementation process. If during implementation, it was found out that the interventions are not effective, or if the success rate is projected to be low, then the initial intervention may be stopped and proceed to a better intervention. No? This is an important approach or pwede nyo itong i-apply so that the resources will be maximized well. So, hindi tayo nagsasayang ng resources. Next step is, pero pag nakita naman na, "Uy, para okay ang result, maganda ang result na nakikita natin." If that is so, then maintain or sustain the intervention long enough to ensure success. And you may loop back to an earlier stage if of the plan if necessary, going back to an earlier stage to refine the processes implemented. No, this will help to ensure that high success rates of the implemented plans. This is to ensure high success rates of the implemented plans. So again, those are the steps of community organizing. Now, let us now proceed to the second part of our discussion, which is health promotion and program planning.